Hello everyone, myself Dr. Hemalatha Ambati, Senior Resident in the Department of Neurology, Narayana Medical College, Nellore. First of all, my best wishes to everyone on this occasion of Multiple Sclerosis Day, that is May 30th every year. Since 2009 it is being celebrated with different themes every year to increase awareness of multiple sclerosis among the patients and the public. I am here with you today to share some awareness about multiple sclerosis. What is multiple sclerosis? It's an autoimmune demyelinating disease of the central nervous system. Our brain cells, neurons, they have a sheath around them called as myelin, which is very much similar to the insulating layer, similar to the electrical wires for faster conduction of impulses in our brain cells. What happens in multiple sclerosis is this myelin gets attacked by our own immune cells, leading to inflammation, destruction, damage and sclerosis. So there is sclerosis at multiple sites, so it is multiple sclerosis. Cause is not known exactly. Some genetic factors and environmental factors are being attributed. Do we Indians get this disease? Previously it was thought to be a disease of the Western world, especially American countries and the European countries, but not anymore. It's being documented in India since 1970. Now 7 to 10 people in 1 lakh population of India are suffering with multiple sclerosis. All over the globe there are 28 lakh people suffering with multiple sclerosis right now. And what are the symptoms of this disease? As it can affect any part of your central nervous system, it can have a wide spectrum of manifestations. It can be simple paresthesias, that is the tingling and numbness sensation in your limbs, weakness of the limbs. There can be gait difficulties, there can be imbalance while walking, bladder, bowel symptoms. There can be visual symptoms in the form of visual blurring, diplopia, that is double vision. There can be cognitive changes also, mood changes, memory disturbances. Sometimes there can be severe depression leading to the suicidal tendencies also. These symptoms, they occur in attacks. In between attacks there is a period of no disease called as a period of remission. In some it may progress steadily with time. It is called as a progressive multiple sclerosis. Actually, in multiple sclerosis, there are varieties like the primary progressive, secondary progressive, the progressive relapsing varieties. And who are going to be affected by this disease? Actually, multiple sclerosis, it is a disease of young. It affects young adults between the ages of 20 to 40 years. More so, it affects women. So, women are 2 to 3 times more likely to get this disease. How we are going to diagnose this disease? Through MRI of the brain, spinal cord, CSF studies, evoked potentials, we can rule out the other differential diagnosis and we can diagnose this. And early diagnosis and early initiation of the treatment, it can give you better quality of life by slowing the progression of the disease and also by decreasing the number of attacks. So be aware of the symptoms and also seek a neurologist immediately. So what is the treatment? No cure till now, no drug for remyelination in multiple sclerosis till now. But such good advanced treatments are available to give you good quality of life by slowing the disease and also by decreasing the number of attacks of the disease. There are symptomatic therapies available. There is therapy for acute flare-ups in the form of corticosteroids, and there are the disease-modifying therapies. Various drugs are available over time, including immunosuppressants and also the bone marrow transplantation. Coming to the women with this disease, they can get married and they can have children without any problem during pregnancy and lactation with appropriate treatment. This disease is not propagated to the children. It's not hereditary. Yeah, and coming to this year's theme is connections. Yeah, building connections. You're not alone. Just build connections with yourself, with the community, with your support groups, and with us, the healthcare providers. We are all with you. You're not alone. Yeah. And in this pandemic time, you may be asking, am I more prone for this COVID-19? If affected, is it going to be more severe with me? No. As per the studies conducted till now, the incidence, severity and mortality of COVID-19 in multiple sclerosis patients is very much similar to the general population. There are few exceptions, like if you are on injection rituximab, if you are affected with COVID-19, you will take more time to recover. In this pandemic, you should not stop your drugs. You should continue steroids, interferons, glatiramer, teriflunomide, natalizumab, dimethyl fumarate. And be little cautious with injection rituximab and fingolimod, and advise not to use elentuximab and also cladribine. And if required, serially monitor your lymphocyte counts. Yeah. About the vaccine, many ask, can I take the vaccine? Yes, you should take the vaccine. Though there are very small risks in the form of adverse neurological, immunological events following vaccination, or there may be slight flare-up of multiple sclerosis after vaccination. But these risks are very, very small compared to the benefits of the vaccine. So you should go for the vaccine. And again, many will ask, is it Covaxin or Covishield? Actually, both are good. If Covaxin is available to you, you can go for it. Otherwise, you should not delay your vaccination, because in this pandemic, you should get vaccinated as early as possible. Only exception is if you are on injection rituximab, you should delay your vaccination for 5 to 6 months, because you may not be able to mount the antibody response to the vaccine. And so take care. Please continue your medications and build connections. Connections with yourself, with the community, with your support groups, and with us, the healthcare providers. Thank you.